Let's see the landmark research studies. लैंडमार्क रिसर्च स्टडीज़, ठीक है। सबसे पहला है जेम्स लिंड। जेम्स लिंड डिड अ रिसर्च स्टडी ऑन विटामिन सी एंड स्कर्वी। तो स्कर्वी वॉज अ मेजर प्रॉब्लम अमोंग द सेलर्स। James Lind, he did a research surgeries and divided the sailors into groups. And then he found out that sailors consuming citrus fruits like oranges and lemon, they did not had scurvy. And thus he established that citrus fruits like oranges and lemon, they prevent scurvy. And he introduced citrus in the sailors' diet. James Lind did a research study on vitamin C and scurvy. Then Doll and Hill, he did a research study on DVT, that is deep vein thrombosis, and breast cancer and OCP. Okay, so he found that OCPs increase the risk of deep vein thrombosis and breast cancer. And the impact was that it led to safer OCP formulations. Doll and Hill, by his studies, they established that OCPs increase the risk of deep vein thrombosis and breast cancer. Doll and Hill studied on OCP. Then ACCORD study stands for Action to Control Cardiovascular Risk in Diabetes. ACCORD study stands for Action to Control Cardiovascular Risk in Diabetes. Action to Control Cardiovascular Risk in Diabetes. This is the ACCORD study. In this, they studied about the macrovascular and microvascular long-term complication in diabetes. Macrovascular and microvascular long-term studies, macrovascular and microvascular long-term complication in diabetes was studied in the ACCORD study. Full form: Action to Control Cardiovascular Risk in Diabetes. Largest cohort study is the Framingham Heart Study. Largest cohort study is the Framingham Heart Study. Cohort study क्या होता है? Cohort study follows a group of people over time to establish to establish the association between the risk factors and the disease. तो उस association को establish करने के लिए they follow a group of people over time. So Framingham study में हार्ट डिजीज़ और रिस्क फैक्टर्स के बीच में एसोसिएशन देखा गया था। और हार्ट डिजीज़ के रिस्क फैक्टर्स क्या है? बीपी, स्मोकिंग, कोलेस्ट्रॉल। दीज आर द मेजर risk factors of the heart disease. So Framingham Heart Study is the largest cohort study. Then MGRS stands for Multicentric Growth Reference Study. Multicentric Growth Reference Study. इसका ऑब्जेक्टिव था ग्रोथ स्टैंडर्ड्स को सेट करना, ठीक है। इट वॉज क्रिएटेड बाय WHO फॉर क्रिएटिंग द चाइल्ड ग्रोथ स्टैंडर्ड्स. सो ग्रोथ चार्ट्स फॉर मॉनिटरिंग ग्रोथ, it was done by the MGRS, that is Multicentric Growth Reference Study. Multicentric Growth Reference Study, ठीक है। इसका ऑब्जेक्टिव क्या था? To set the growth standards for children. जो healthy children होते हैं, they have similar growth patterns worldwide. Then we have Solidarity Trial. Solidarity Trial, it was done to assess the treatment of COVID-19. Solidarity Trial का ऑब्जेक्टिव क्या था? COVID-19 ट्रीटमेंट, ठीक है। It is the largest international clinical trial to assess the treatment of COVID-19. ठीक है, इसका की फाइंडिंग क्या था? टेस्टेड 4 treatments, none significantly reduced the mortality. So Solidarity Trial का ऑब्जेक्टिव क्या था? COVID-19 treatment. It was the largest international clinical trial to assess the treatment for COVID-19. Then we have MRFIT. MRFIT stands for Multiple Risk factors intervention trial. Multiple risk factor intervention trial. Okay, and objective was to see the effect of lifestyle modification on CAD and IHD, cardiovascular disease and ischemic heart disease. MRFIT stands for multi risk factor intervention trial. Multiple risk factor intervention trial. CAD stands for coronary artery disease. Coronary artery disease, and IHD stands for ischemic heart disease. So MRFIT stands for multiple risk factor intervention study. MRFIT का ऑब्जेक्टिव क्या था? लाइफस्टाइल मॉडिफिकेशन ऑन CAD और IHD को स्टडी करना. MRFIT stands for multiple risk factor intervention trial. Multiple risk factor intervention trial. Then we have Oslo study. Oslo study objective effect of smoking and lipid levels on CAD. इसका finding क्या था? Lowering lipid levels and smoking causation can reduce CAD risk. Oslo study से क्या पता चला कि स्मोकिंग को बंद करने से और लिपिड लेवल्स को कम करने से कोरोनरी आर्टरी डिजीज़ का रिस्क कम होता है. ठीक है. Oslo study was on the effect of smoking and lipid levels on coronary artery disease. Oslo study, effect of smoking and lipid levels on coronary artery disease. Last we have Monica trials. Monica trials, assessment of many risk factors and associated factors for CVD. Multinational monitoring of trends and determinants in cardiovascular diseases. CVD stands for cardiovascular diseases. So Monica trial was done for the assessment of many risk factors and associated factors for cardiovascular diseases. ठीक है. cardiovascular disease जो है ये एक broad term है जिसमें बहुत सारे conditions आ गए जो कि हार्ट और blood vessels को affect करते हैं. So उसके लिए उसके risk factors और associated factors के लिए Monica trial was done. Monica trial was done to see the CVD risk factors and associated factor. Multinational monitoring of trends and determinants in the cardiovascular disease. Multinational monitoring of trends and determinants in the cardiovascular disease or the Monica trial. It was for the assessment of risk factors and associated factors for CVD. Last we have Stanford trial. Stanford trial का objective था health education and its effect on CAD. Stanford trial का objective क्या था? To study if health education can reduce CAD risk in 3 communities. Okay, Stanford trial was done in 3 communities. The objective was to see if health education can reduce the risk of coronary artery disease. It was to see if health education can reduce the risk of coronary artery disease. Findings क्या था कि communities receiving the health education showed significant improvement in diet, exercise and smoking habits. Impact was that showed that public health education is an effective tool for preventing heart diseases. तो स्टैनफोर्ड ट्रायल से पता चला था कि हेल्थ एजुकेशन के कारण काफ़ी सारे डिजीज़ेस कम हो सकते हैं, हार्ट डिजीज़ेस कम हो सकते हैं बिकॉज ऑफ health education. And Stanford trial was done in 3 communities. This was about the landmark research studies. Vitamin C and scurvy by James Lind, DVT, breast cancer and OCP by Doll and Hill, macrovascular and microvascular long-term complication in diabetes, ECORD study. Largest cohort study is Framingham heart study, growth charts for monitoring growth by MGRS, multicentric growth reference study, largest international clinical trial to assess treatment of COVID-19, solidarity trial, then MR FIT, that is multiple risk factors intervention trial for the effect of lifestyle modification on CAD and IHD, Oslo studies for effect of smoking and lipid levels on coronary artery disease, Monica trial to see the risk factors and associated factors for CVD, Stanford trials तीन कम्युनिटी में किया गया था फॉर द हेल्थ एजुकेशन एंड इट्स इफेक्ट ऑन CAD.